Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the COVID-19 pandemic update for February 2nd, 2022. Actually, February 3rd, 2022. I should have started February 2nd because then it would be 2222, and I think many of us feel that way about the pandemic, right? It's been going on too long. We've got too many people that aren't vaccinated, and we keep saying the same things over and over again. But moving on, this week the three questions are: is the Omicron surge coming to an end? What does it mean to be fully vaccinated? A question that's come in several times. And then a question I get quite a bit, which is, what should I know about treatments for COVID-19? In terms of the Omicron surge coming to an end, you can see that there has been a slight dip in the number of cases worldwide, but it's still way above what it's ever been before. In terms of deaths, unfortunately, we continue to see this rising number where it's now almost as high as it was at the last peak. 5.7 million deaths to date, almost 10,000 deaths every day. This is still going on in a really bad way. In terms of the United States, we're seeing a greater drop in the number of cases, but again, we're not seeing a drop in the number of deaths, daily deaths. And in fact, we're now at the second highest peak we've ever had in terms of daily deaths. Almost over 900,000 deaths to date and about 2,300 deaths every day. In terms of hospitalizations, you see this recent spike. It may be coming down. We'll have to follow that over time. But obviously, cases lead to hospitalizations. Hospitalizations lead to deaths. We hope we're going to see all of them coming down soon. In terms of where the pandemic is occurring, if you watch the evolution over the last 7 weeks, it was growing everywhere. And then this week, it's starting to thin out a little bit in the Northeast and in the Midwest, but here in our central Appalachian area, it's going unfortunately strong. Now in Tennessee, the number of cases is also coming down. The deaths have really not done anything particular. They seem to be leveling off. We've had almost 23,000 deaths, and we're running about 70 deaths a day. In terms of hospitalizations, again, it may be coming down, but very close to the peak, the highest that it has ever been for our state. In terms of the Ballot Health Service area, as of yesterday, they had the highest number of hospitalized patients they had ever had. 87% of the hospitalized patients are not fully vaccinated, 94% of those in the intensive care unit, and 97% of those that are intubated. And I'll talk in a moment about what it means to be fully vaccinated. If you look at the number of cases, the number of folks in the ICU and the number of folks who are intubated, you can see this widening gap. As we've talked about before, it was running about 24 to 28%. It now seems to be leveling off around 17%. And that's probably because vaccinated folks are less likely to have severe disease. It may be because Omicron is a little less serious. There are better treatment options. And some of these are now incidental infections. But again, leveling off at about 17%. And importantly, if you look at where we are now compared to where we were in late October, early November, you can see that everything has still been going up. Hospitalizations going up a lot, but even a 50% increase in ICU admissions and in intubations. So is the pandemic coming, is the surge coming to an end? It appears to be slowing down in terms of cases. We'll keep our fingers crossed in terms of hospitalizations and deaths. Now, I alluded to the question of what does it mean to be fully vaccinated? Well, according to the Centers for Disease Control, you're fully vaccinated if you've had an appropriate, approved single-dose vaccine or a series of 2 doses for an approved vaccine. So again, in the US, we've got the single dose, the J&J, and then the 2 RNA vaccines, Pfizer and Moderna. But there are several others that have been approved by the World Health Organization. So the CDC goes on to say, in answer to a question, am I considered fully vaccinated if I don't get a booster shot? And they say yes, which is a little bit of a debatable issue. But they go on to say fully vaccinated is not the same as optimally protected. All right. And so some data that they had from October and November showed this huge difference in the weekly deaths per 100,000. Unvaccinated, 7.8, vaccinated with no booster, 0.6. and with the booster 0.1. So you can see the massive increase in safety, reduction in deaths if you're vaccinated, even more if you're boosted. And that's about 1 in a million, which is really good. And it's about half the chance of dying in a car accident. So again, and thanks to Rob Pack for pointing that statistic out to me. And some have said, well, that's great, but those are pre-Omicron, and that's true. But some data has now come out from Los Angeles County on the Omicron era, if you will, from November to January. And they looked at hospitalization rates among unvaccinated people. It was 5 times higher to be hospitalized if you're unvaccinated than if you're vaccinated without a booster, and 23 times higher than if you're vaccinated with a booster. So data are clearly indicating that the vaccine with a boost is by far the best protection you can have. So officially, you're fully vaccinated if you've had 1 J&J or 2 of the mRNA, but my advice to anyone would be to get boosted as well. Now, a question that comes in a lot is, what should I know about treatments for COVID-19? Well, my advice to you is this. Only take healthcare advice from your trusted healthcare provider or a specialist that he or she refers you to. That means you should not be getting treatment information from the internet, podcasts, radio shows, TV news, political leaders, religious leaders, friends, or me. All right. You should only get your health information from your trusted healthcare advisor. And that's why I've been hesitant to share information. But remember, I worked for 11 years at the Food and Drug Administration. And I will tell you, yes, there are plenty of unproven therapies that may work. But the problem is we only know if they work, or how to use them, or what dose to take, or how often to take, or what the side effects are after controlled clinical trials. So all this information saying, well, ivermectin works, or vitamin D, or zinc, yes, they may work. But if we don't do clinical studies, we don't know how to use them. And it doesn't do us any good to have a drug that may work if we don't know what dose to take, how often to take, or what the side effects are. Even then, even when a drug is approved, you need to talk to your qualified and trusted healthcare advisor to know whether you're likely to benefit from the treatment. Every treatment is a balance of risk and benefit. So when in doubt, ask your healthcare provider. Now, Joseph Viola very kindly shared with me a link to a PBS NewsHour on the treatment, which was drawn from this NIH paper, both of which are referenced down there. But the basic guidelines is this. If you have symptoms, get tested as soon as possible. And if you test positive, talk to your healthcare worker right away, because some treatments only work if they're given early. And there are several that are restricted to folks who are in high-risk groups. And then there's this nice diagram in the PBS NewsHour that tells you a little bit about the different regimens. But be sure to tell your healthcare provider what other medications you're taking, prescription drugs, over-the-counter, dietary supplements, anything else that might interact. And remember, I think it was Benjamin Franklin who said an ounce of prevention is worth a pound of cure. As good as any treatment is, the evidence right now overwhelmingly is getting vaccinated and boosted, wearing an appropriate mask, and avoiding crowds is by far the best way to protect yourself from serious outcomes of COVID-19. And if you're in any doubt, ask your healthcare provider. So is the surge coming to an end? In terms of cases, it appears to be coming down, but it's still, in terms of deaths and hospitalizations, way, way higher than we want to see. Fully vaccinated officially means 1 dose of the J&J, 2 of an mRNA, but in reality, you're better off if you've been boosted. And in terms of treatments, I'm not going to give you advice. Talk to your healthcare advisor. Great deal more information about COVID-19 on the College Public Health website. If you know anyone who'd be interested in getting these podcasts, these videos, please let me know. I'd be happy to share them at no cost. I'd like to thank Dara Young for editing, producing, and posting this and all the other COVID videos. And if you have any questions, as you can see, I try to answer them as much as I can, either by return email or in one of these weekly videos. So until next week, please be well.